site, which, okay, let's wait for a short while. People come in first.
Morning, Loka. When is my group sharing for the legacy product for the morning 9:30 meetings? Good morning, Lok. Check with you. My office supposed to share legacy product on 9:30 morning. Which
CT, I'll send to you.
Following week.
CT, I'll send to you the list.
Oh, okay. Thanks. I was trying to call Lok. Thank you.
Okay. Hey, people, let's wait for a short while.
Guy, Johnson.
Johnson, Shirley?
I think you can start because the appointment. Better.
Oh.
Okay.
Okay, can.
Thank you.
Okay. So today we'll be sharing the because if we talk about medical card, there are a lot of things that are covered, so like so we cannot say what is covered. So that's why we sometimes we cannot tell the our prospect or our clients what are covered. It's better because there are a lot of things that are being covered, but we should highlight to them what is not being what are the exclusions. So they will know in the event that they fall under that category, they are aware. When you when you manage them in this way, so they will, in the event it happens, oh, my agent told me before, these are the conditions that is not claimable. So then they will not jump because if you don't tell them, you just tell them what is claim, or they think everything is claimable. So in that way, it's good so that to let them know ahead so that you can manage the expectation when things happens. Okay, so this one is taken from the maybe it have been shared earlier because I didn't attend all the session, but it's always good to repeat and share This is what I got from Michelle's the website, our GELION website. So on exclusion. Okay, so I share screen now. Okay, so can you see my screen? Can
Yes, can.
Okay. Have you all seen this this PDF or this slide? Anyone has not seen this before? Got seen this before?
No.
Okay. No. This is in the the Michelle's GELION website portal. So there are a lot of things there So today we'll share some technical knowledge is on some refresher on exclusion and limitation. So there are 44 pages, but half is in English so it's actually 20 over pages So we go through one by one. So let you all know what is exclusion. There's only 22 exclusion. So it's easier to tell them instead of telling them what is claimable. What we usually say, medically necessary is claimable. So there are a lot of things are claimable. So this list will give us a give us something to share with our clients. What are the exclusion and limitation? First thing, you have to tell your clients the one is pre-existing illness. Any pre-existing condition, existing condition is a medical issue that is experienced in the past. This includes chronic condition like diabetic, asthma, and one-off symptoms like knee pain. Reverse pre-existing a pre-existing condition is when you have a symptom, medication advice, treatment or test or something before taking our health cover. So all these things are so you know lah. So before anything that we have before we take up the medical card are not covered. Pre-existing are not covered. Okay, so diabetes, heart disease, kidney disease, hypertension, heart attack, stroke, chronic respiratory disease, and cancer. This one we can WhatsApp. You can get it from the website. Okay, get it from the website and read again. So we just go through one round first. So you'll be surprised, sometimes when you meet clients, they will say, I experienced this before . So we talk to them, ask him, are you okay or not? How's your health condition? Are you okay? Say, okay. Then after that, I asked him, do you have hypertension? They said, yeah, I got hypertension. Then they will say, hypertension is a disease, man. It's a condition. It's normal. So that kind of thing is this. That's why you don't ask them whether they are healthy or not. You have to ask them specifically, do you have this? Do you have diabetes, hypertension, heart disease? I think heart disease they know but hypertension sometimes they take it as a norm because a lot of people have it and they think it's a part of aging. So it's something that we do not have to disclose. It's understood. So it's not that way So in this way, if during the process of sharing with them on medical card, so you have to let them mindful. You have to let them know of all these pre-existing illness. Do we have this? Do we have it? Specifically ask them, which is actually in the proposal form. If you go through one by one, is there already. Okay, so the first thing, so we have to tell them these are not covered. Now this is the Chinese version. Okay, second thing, you have to tell them specific illnesses occurring within the first 120 days from the risk effective date, means the enforced date of the medical card. Or the reinstatement date. So if you lapse the policy and the policy is being reinstated, that is also the effective date. It's not the first date when you first bought the policy. Is the date you get reinstatement. It starts again from that day. The first 120 days, there are specific illnesses that are not covered. Okay. So what are the specific illnesses that are not covered? This one, hypertension. So if you have any. If a person bought a policy, okay, he doesn't have a medical, there's no diagnosis on, he doesn't have a history of hypertension, for instance, before he bought the medical card. So he bought already, no, because he doesn't feel anything, he have not seen doctor, so he doesn't know, and there's no treatment and nothing. So he said don't have. So in the event, after he bought the policy, within the first 120 days, in the event that he is hospitalized due to hypertension, or maybe even cardiovascular disease, or all this condition, it will not be claimable within this 120 days. Okay, so these things, in addition to pre-existing illness, there are certain conditions that are specific illnesses that are not covered within the first 120 days. So you have to let them aware of this. Also, they know that. So in the event, you don't think that 120 days is a very short period. We have experienced when people have bought a policy, 2 weeks after they buy the policy, or even a month after 30 days after they buy the policy, they are admitted already. So we have to we cannot say, 120 days very easy to go through. It's not that way. So it's better you tell them upfront, so that in the event happens, they are aware of it. Okay. Now hypertension, these are all shown here for you. Hypertension, diabetes, cardiovascular disease, all tumor, cancer, cyst, nodule, polyp, stone, urinary in the urinary system and biliary system, all ear, nose, and throat, like this, and throat condition, hernia, hemorrhoid, this all this lah, endometriosis, knee spinal disorder, knee condition. Okay. So this is the two pre-existing. These are two exclusion. The first two exclusion. Okay. One thing I want to add on is this pre-existing illness. If you have not, if a person, I just want to ask, just interact a bit. If a person is when you see that person at time, he say he has not seen the doctor. He has not seen go for any checkup. There's no X-ray. There's nothing lah. And then, but you obviously see there's a lump on his back, just for instance, or on his hand. Is this a pre-existing illness? Anyone want to answer this? No medical history, but you can obviously see there's a brick lump there already.
Yes, it's a pre-existing.
Yes, yes.
Yes, yes.
Okay.
Existing. Yeah.
So there's no medical history, there's no medication, they have not seen doctor, there's no checkup. So in other words, that is not add into here. These are also pre-existing because a layman doesn't know if he has any condition. But if you can reasonably see from the exterior, physically, you can sense it, you feel something, it's also a form of pre-existing. It's also something that you need to get, you need to disclose. If there's a lump there, you don't see doctor, it's also something you need to disclose. If there's you lose weight a lot, or you have stomach pain, very severe pain, it's like that. Although as a layman, you may not know what it is, but it's your duty to disclose this. It could be a pre-existing illnesses. Okay, so that may be a pre-existing. As long as you, as a layman, you feel something, it's a pain, it's a lump, visible, we can see. Okay, that's also pre-existing illness. Okay, next one. Next one is any medical or physical condition arising within the first 30 days of the risk effective date. So any medical or physical condition arising the first 30 days from the enforced date or from the reinstatement date also fall under exclusion, except for injury. Injury means accident. If it's injury, immediately when the policy enforced the following day or even the following hour, he injured himself, that one is claimable. Okay, it's claimable. But if it's something that is illness within the first 30 days is not covered. Okay, I've experienced this before. So sometimes we have to be you have to be ready for claim the first week or second week after even the first week after the policy is enforced. I've experienced cases like COVID cases just 1 week after the policy enforced. I've experienced this foot-mouth disease for children 2 weeks after the medical get enforced. So if you don't tell them that, they get admitted for children. I mean, if the condition is severe and they will want to get admission. So if you don't tell them, oh, this foot-mouth disease illness is not covered within the first 30 days, then the person will feel we have not done our duty . Okay, so if he's aware, then okay too bad because we have tried to do appointment very early on, but he's not free so this is too bad Also, that kind of things at least we have told them upfront Okay, so plastic, cosmetic surgery, circumcision, eye examination, glasses, all these eyes problem, all these things LASIK, implantable this one and the use and acquisition of external prosthetic appliances, all these things are not under the exclusion also. Okay, so there's some drawings here plastics surgery, circumcision, eye examination, LASIK, radiokeratomy, all these things external prosthetic appliances. Okay, these are things that are not covered, also not covered. But it's on this one a general exclusion But if it's something that like circumcision, like sometimes it leads to, if it's medical necessary, but if there is this issue usually it is the GL will be declined one. Usually it will be declined one. But we can always appeal if we can prove that it is if it's something medically necessary, it is an illness or an infection or something like that. It's on a case-to-case basis. So generally, it will be exclusion. Okay. So the next one, dental condition. You cannot use your. We have also experienced people who ask whether we can use medical card to do a dental thing, to pull out a tooth and something like that. Okay. So these are things you have to tell them. So is dental condition, including dental treatments, are not exclusion except for necessitated by injury to sound natural teeth occurring in any policy. Means it is accident. If you accidentally you fall down and you broke your tooth or you need an implant, that one can. I have also claimed before, but it must be an injury. So this person do an implant, and then it's claimable. Okay. I think 3,000-4,000 that's something claim, but it's so that one is claimable. Okay. So private nursing except provided under our post-hospitalization home nursing care. You are aware that our medical card has got this post-hospitalization home nursing care up to I think 8,000. So this is covered lah. But private nursing in general, it's not covered. This rescue, sanitary, illegal drugs, intoxication, sterilization, all these things are not covered. Any incommunicable disease, mean anything that needs to be disease that needs to be quarantined by law lah. So are not covered, which includes COVID-19 in older plans but the later plan, even now SMS, except COVID-19 is covered. Okay, and COVID-19 is covered under a medical card, but other communicable disease which require quarantine by law are not covered. So next time if there's a COVID-24, then it's not covered because it's another thing. We only covered our medical card only covered COVID-19. So you have to be mindful the next time people I'll tell them COVID-19 cover. Next time if there's a COVID-24, then they say, oh, why not covered? Because it's a different thing. Our medical card currently covered COVID-19. It's not cover all disease which require quarantine by law. Okay, so this one you have to inform them let them be aware of it Okay, any treatment or surgical operation for congenital. This is an important word congenital and congenital condition. So this congenital condition are something that I think we are born with You're born with. So this so when we use we talk about exclude medical card, I always inform if the doctor says if the diagnosis is a congenital condition, it's not covered. Okay, so it's not covered. So this one you have to tell the policy holder or the prospect. Okay. Okay. Pregnancy medical card cannot be used for pregnancy related pregnancy, childbirth, surgical delivery, all this miscarriage, abortion, all this prenatal, postnatal care. Those things are not covered under medical card. Pregnancy, childbirth related. Okay. So all these are not covered. So if you want to have any covered on pregnancy related or even it's under our prenatal plan. Okay, prenatal plan. Okay, now this one is a tricky one. It's number 9. Hospitalization primary for investigation purposes. Diagnosis, X-ray examination, general physical medical examination, not incidental to treatment or diagnosis of a covered disability or any treatment which is not medically necessary, and any preventive treatments, preventive medicine, or examination carried out by a physician and treatment specifically for weight reduction or gain. This wording are long because it's from the policy contract. It's from the policy, so we use word by word. Okay. So mainly, what does it mean is that if you go to the hospital, you just do diagnostic. You just go in and do a lot of CT scan or diagnostic. Just for investigatory purposes, it is not covered. So you have to, you go in, there must be a after you do all this examination, it must lead to a diagnosis that needs to admission. Then which needs to be treated, which needs to have a procedure. Procedure means you need to have a treatment. So in that way, only then all these things are covered. If not, you just go in there just to do X-ray, do ECG, all those things. If you come out the result is nothing, then it's not covered. It becomes a health checkup, something like you go for a blood test or you go for your stress test. So if you go for that, it's not covered under the medical card. Okay. So this time, this is quite tricky because sometimes when we experience that's why you have to alert them earlier on, because we have experienced like people who have it sometimes when they have indigestion, they can have gas a lot. They have indigestion, they have a lot of gas. So they may feel chest pain. Just chest pain. Sometimes if you tell them they feel chest pain, they feel uncomfortable. We cannot tell them don't go and see doctor. It could be a heart attack, could be some other medical condition. So but you tell them if you go there and you do a lot of checkup, and then eventually it's just it's nothing, there's no issue, that it will be not claimable. But they still have to go because it could be urgent, it could be something serious. So but you have to let them know. Okay. So I've experienced all this before also. But if they after a while, this indigestion kind of thing, after a while, it will subside on. Nothing, then eventually back to normal. But during the time, it feels very emergency. Because it's very urgent. Because it could be a heart attack. So that one we have to be careful. So
you mean admitted, let's say chest pain then did the ECG, then everything and then after that found out to be reflux right? So cannot claim it? Can claim under reflux, right?
Can. You must have a diagnosis. You must have something like reflux. Reflux is a medical condition. Then you need treatment. That's why you need to have something. You cannot be right. You go there, and then there is no then the doctor say you're okay, normal. You have to write something there You must put there that is a condition. The doctor will sometimes know what to do. Like you do for a scope, they will put in inflammation and things like that. You have to have a diagnosis. You must have a treatment. That is claimable.
Okay.
You have to on that. Okay.
How about endoscopy and colonoscopy? A lot of people they just go for this.
But usually, a lot of people, most of people the doctor is aware, and then they will usually put something. I believe if a lot of people, any people who go in do a scope endoscopy or colonoscopy and their claim is approved I believe the doctor have put in something, a diagnosis and a treatment, so there is a medical condition already.
They claim cashless payment for this.
Yes.
I heard many of them.
Yes, they have done.
There are a lot of people.
Sorry, I share this one, Kai. Sorry.
Yeah, please.
This is some back a few years ago. I didn't know. I did a colonoscopy. 2015. So later I upgrade my medical card. So then I need to declare. Then I noticed that the doctor wrote I have gastro something. But I went and told the doctor, no, I don't have any of these symptoms. Why did you write without my consent?
What did the doctor say?
He didn't say anything. He kept quiet. He said, a long time already. That's the way we have to do lah.
Yeah, that's why.
But I say he should tell me. You know what I mean? You know, he should tell me, Well, then now the company think I got gastric.
The company don't cover on this if it's recent
Nancy,
exclusion?
impose any exclusion for the upgrade?
No. I don't have So no lah. When they check, I don't have. I don't have one.
You have a claim, and then eventually when you upgrade, there's no exclusion. They take you as
normal. Yeah, because it's just a colonoscopy, They just done she wrote it. I think just a mild, like I was discomfort, that kind of thing. But I don't have any exclusion on that.
Oh, okay.
I don't actually I don't have lah, but they I think when I went for checkup, there's nothing there, so they didn't do any exclusion.
Is it after a few years or many years or
A
just
few years, I mean many years, actually many years. Then any
many
upgrade.
years? Because if a person has got gastric problem of issue, if they have experienced one time and then after 3 years down the road of there's no reoccurrence, we can always go back to appeal. I mean,
Yeah.
so then they can remove the exclusion. It's a one-time. Probably your case is something like that, but a lot of people are actually suggesting people to their policyholders to use medical card to do scope. Use it as a medical as a health checkup, because after a certain age you need to it's good to go check up. It's good to check out, but if you use medical card and then and if the claim is approved, means that definitely the doctor would have wrote something there. So there will be a medical condition already. So
because my case, okay, why I have to do
hello. Sorry, disturb a bit. Can we let Guy continue on first? Because he got appointment 11 o'clock. So this one we can discuss later. Thank you.
Okay. So that's it lah. So I'm just saying that if it's for the doctor will know a lot of people if they want to claim medical card they're aware that this is they will need to write a medical condition in order for claim. Okay, next. Okay, this one very obvious. Attempted suicide, intentionally inflicted injury while said and insane. So these things are not claimable. So I've experienced one case. Want to claim medical card, went to the hospital. No, he took I think 40 or 40 this what is it called? The sleeping pill. Have to go hospitalized. So this one are not claimable because it's too much. You cannot say mistakenly took so many. If you took a few maybe lah, but this one like 40 tablets is a lot lah. So these are intentional. Whether you are sane or insane is I don't know whether it's attempted suicide lah. So it's this case was not claimable. Okay. Okay. War and act of war. All this criminal terrorist activity, these kind of things are not claimable. Okay. This ionization, radiation, contamination by radioactive or any nuclear fuel waste from processed nuclear fusion and foreign nuclear weapon material. This one we rarely see lah, but it is because it's widespread. This thing, if it's not claimable because it's not that they don't let you claim, but this thing usually affect a lot of people. So if they let you claim this one, the medical card will go bust one. It's a big issue already lah. When you have this one, a lot of people will get hospitalized. So it's a standard exclusion. Okay. Just like the COVID-19, if they let COVID-19 claimable, quarantine by law, then it will be the claim cannot be quantified. It will be over already because it's a pandemic. Okay. Now, expenses incurred for donation of any body organ by the life assured and the cost of acquisition of any body organ donated to the life assured, including all costs incurred by the donor during the organ transplant as obligation. So these expenses incurred, including the cost of acquisition of the body organ, are not claimable under the medical card. Okay. Investigation, this one, investigation and treatment for sleeping disorder, snoring disorder, hormone therapy, this thing are not covered lah. Okay, are not covered. All this on alternative treatment such as treatment medical expenses, medical service and supply, including but not limited to chiropractic service, acupuncture, acupressure, reflexology, bone setting. These are like TCM lah, this TCM thing, or other alternative treatments, except provided under this our post-hospital chiropractic, speech therapist, occupation, unless this is, anyone know what is this? Anyone know what is this? Why is except which
Physio. Physio, right?
Physio, yes. This one post hospitalization chiropractics is covered under our SMS, but under room 400. Room 400. So if you want to have room 400, that's one of the benefit of taking up room 400. So if you've got room 400, these are covered. Okay, you check your product write-up. So these are actually one of the things that are covered under our SMS plan, but it's under the highest plan. Okay. Care and treatment for payment which are not required or the extent which is payable by the insurance company means that it is covered by other things. Like means you use that you have claimed that medical expenses under some other parties or some other insurance company or even your workman compensation or whatever means you have been reimbursed lah. So you cannot claim twice lah because medical expenses, hospitalization, we incur expenses. The medical card reimburse us, but it doesn't reimburse us if we have claimed somewhere else. Okay, that's what it means. Okay, so you cannot have two claim twice lah. That's why we need original bill for medical card. It's not that sometimes we experience that people say, I went to the hospital to get the invoice and get the bill. It's not, we are not insurance company are not disputing whether this treatment has been given. It's just that you cannot give the original. They are concerned that it has been claimed somewhere else. The original receipt has been given to some other parties. They are given to other parties. So you are claiming the duplicate again. That's what they don't want. They don't want to have multiple claim. Okay, pay twice, pay 3 times, that kind of things cannot lah. So every time when they get hospitalized, it's also important you tell them. This is also something you tell them because they when they leave the hospital get discharged, they always forget this one. They don't know where they discard all these invoices, original receipt, or they even don't take. You face it all the time, but if you tell them, they'll be more careful. And even if they lose it, you told them already. You have reminded them to be careful, and they lose it, it will be better. They will take responsibility. But if you don't tell them, they'll do all sorts of things. They'll say, yeah, why so unreasonable and things like that. I did not claim for other places. It will complicate the matter and then make us harder. Okay. But now with e-claim, I mean, it's easier. We need to scan copy. But eventually, if they need to audit it, you still need to provide the original copy. So it's best you keep the original and have the original with you. That's the important thing. Okay, psychotic, mental, nervous disorder, all these things are not claimable under medical card. If you have this medical condition, depression, nervous breakdown, anxiety attack, all these things are not claimable. Okay, if you get hospitalized for that, it's not. Okay, cost incurred for expenses incurred for non-medical nature. So these are the things that not claimable. If you use the TV, telephone, radios, or whatever facilities that are non-medical, then they are not claimable. Okay. Sickness and injuries, arising from racing, of any kind except foot racing, hazardous sports, such as but not limited to skydiving, water skiing, all those things which are hazardous sports are not covered under the medical card. Okay. Private flying, other than those fare paying, if you pay your fare, you go on a trip, then it's covered. If it's private flying, then it's not covered. Okay. Expenses incurred for sex change, okay, these are not covered. Any outpatient treatment not related to inpatient treatment, except as provided under insured benefit. So outpatient, generally, that's why we say generally, we said outpatients, you need to get admission for illness. Okay, if it's accident, then it's outpatient accident, then we can claim. Or even now we have day surgery or daycare. Those things that because advancement in medical treatment, so some things that previously needs to be admitted, now they can do it safely under daycare. So those are the list of things that we can claim under daycare that doesn't need hospital admission. But this one is any outpatient treatment not related to inpatient are not claimable. Okay. exclude outpatient treatment not related to inpatient except as provided under insured benefit. Okay. Now, what is this? This is 21. Oh, this two Chinese. Okay. Any charges not reasonable or costly charges or surgery treatment which is not medically necessary, charges in excess or reasonable prices are incurred for hospitalization, pre-hospitalization or post-hospitalization after expiry date. So there are certain things that are charges not reasonable or customary, not medically necessary surgery or treatment, or charges exceeding reasonable and customary and post-expiry date hospitalization related charges. What does this mean? Means it the claim must be medical. First thing is it must be medically necessary, and then it must be reasonable charges. Sometimes I think GL rarely we don't feel it, but if you pay it yourself, that's why there's a danger if you pay yourself. If you pay yourself, we have experienced this before, but those are many years back but recently are not so many that those that you paid those you paid first and file for claim if the expenses sometimes are exceeding reasonable charges the insurance company don't pay one. They will pay you a certain limit only. The extra they don't pay. So that is the problem when you do a fine claim. Sometimes GL rarely because maybe they will check through the bill, they will settle it there. So there's less of this issue Okay, so this one and then post expiry date means if the post hospitalization date is 90 days and you exceed it, obviously it's not claimable You have to tell them there's a pre and post there's a date before admission and there's a date after discharge. Within that period you can claim. After that it's not claimable. Okay, so these are the probably 22 22 exclusion. So you tell them all this So from them they will have some understanding, and in the event it happens, they will be aware of it they will not ask, they will not say we didn't tell them. Okay.
Okay.
Okay, that's it for two. Anything else you want to ask? Is this an additional, sometimes refresher just to let us know for these things?
Kai, all this you can post to cash or not later?
I don't know. Wait, can we post to cash or not? This one I got it from Michelle's website portal one.
I think it should be no problem.
I think Kai, you put it into the agent handbook our agent handbook.
Agent handbook.
Kai, can I ask a question? Just now you said about very fast you said about a congenital. What's congenital?
Congenital.
Okay. If a client has buy a policy for his son before he was born, okay.
Before
just after he born few months. Okay, after he's born, and then after 3-4 years later, 4-5 years later, he realized. The son was not speaking, and then they realized that it's congenital. Congenital. What?
Congenital.
So, congenital. So, what happened to the policy then?
Okay, that's my understanding. If you buy the policy, even if you don't care if it's prenatal, you buy it before the child is born. It's better you buy before the born. Then everything is because the gynae doctor write everything already. You buy is effective already. Even you after birth, and they found that this child is not normal, the policy is enforced already. They will not void your policy because it's pre-congenital. It's prenatal. Even if the child, as I know, if the child is say 1 year old 1 month old they buy after the child is born, and then after 14 days or after 30 days they buy the policy, and then there's no issue, there's no history of the congenital condition, and the policy enforced already. So maybe 1 year, 1 year old, 2 year old, even 10 years old, they've realized that this you got admitted for a congenital condition. They found a hole in the heart or whatever that requires treatment. It will not void the policy because you are not aware of it. But if the word comes out, you cannot use medical card.
No, but the thing is that, okay, this one real case. At the moment I just left it, because I went to Great Eastern Ipoh, they say congenital, that's it. They cannot tell anything because They bought it under OAC. Okay, the child is now
This is
16.
this and what do you mean? You
medical card they
Yeah.
bought long time lah. Then she asked me
Check with
again now. You know what going to
Oh.
happen? Shall I surrender because they can't pay anything? So why am I continue paying?
you still cover other things, ma. You still cover other things, right?
Oh, but
You don't cover the congenital. I don't know what condition it is. You don't cover the
she's
congenital.
autism now. They classify him as
If you tell me if it's autism, if you have bought the medical card and you didn't before that, there's no sign of autism. There's no sign because it's still a child. You cannot see it, ma. So you bought this medical card. I think it's okay. You will cover you for dengue or accident or whatever, but it don't cover you for congenital disease.
okay.
If it's autism and then you cancel a plan, you cannot cancel. If you cancel a plan, you buy a new plan, you tell them autism, they won't even accept it.
Yeah. I know. That's why I told her to leave it. But
Yes, don't.
she still come back lah. You know, now she's about 19 or 20 years old. So
You cannot. I faced this problem. I faced this case because the child looks healthy to me. This is a child, you don't talk. We do not know anything. We just bought the policy 1 month old. Then the policy is enforced, and then he claimed everything lah. And then now realize after a while, maybe 2 years old, that you feel the child was diagnosed with autism.
Okay.
So this case,
Okay, thank you.
Thank you lah. Don't disturb you. Thanks.
You go for your appointment. Okay, for your information, all policy congenital sure no cover one, even though your policy up to 20 or 30 years. Okay, bear in mind.
But they won't cancel your policy lah.
Yeah, of course, they won't cancel your policy. Still should carry on. Okay. Okay, thank you.
Thank you, Shirley.
Okay.
Thank you, Kai.
Thank you.
Thank you, Kai.
Okay, welcome. Thank you.
Bye.
Yourself.
Thank you, Kai.
Thank you.
Thank you.